Hi, I'm Skylar Kenny from Pharmacy Times, and today I'm speaking with Guillermo Torre-Amione, the chairman of Cardiol Therapeutics, on a phase 2-3 outcomes study assessing oral cannabidiol, or CBD, in hospitalized patients testing positive for COVID-19, as well as what the company has in the pipeline for anti-inflammatory therapies that treat cardiovascular disease, which places COVID-19 patients at a significantly higher risk of mortality than those hospitalized with COVID-19 who do not have cardiovascular disease. So Guillermo, are anti-inflammatory therapies currently being used to treat patients hospitalized with COVID-19, or is this something the research being conducted now is looking to assess?
No, I think it's important to understand the pathophysiology of COVID. Yes, there are plenty of anti-inflammatory drugs that are used in late phases of COVID. So if you allow me for a moment just to explain how the illness progresses, is that initially you get infected with a virus. There is a latent period where the virus is replicating, and then the initial reaction of your body is trying to fight the virus. So if you suppress the immune system at that time, the virus will replicate further. So it's not a good idea to treat with anti-inflammatory strategies during the first phase. Then your body will try to conquer, and essentially it kills the virus, but the virus within the body, it triggers a cascade of inflammatory reactions that augment or increase the severity of the illness that's produced by the infection. So in the second phase of the illness, a variety of anti-inflammatory drugs have been used. The novelty of CBD stems from the fact that it is not necessarily a wide anti-inflammatory strategy. And specifically, we're trying to block the inflammatory cascade that injures the heart. And there's extensive basic data produced by our laboratories and by others that demonstrates that CBD has a powerful anti-inflammatory effect that injures the heart. So that is exactly what we're trying to do in Cardiol. Use CBD as a mild systemic anti-inflammatory agent, but with profound anti-cardiac action, which is really what we're trying to demonstrate in the trial that you alluded to.
Before this study, were patients hospitalized with COVID-19 being given CBD?
No, before this study, no. There is a recent report in JAMA that a group in Brazil used CBD to manage the stress associated with the injury, with the illness, with the with the social impact of the illness, but not necessarily CBD as an anti-inflammatory agent to protect cardiac injury. So it's a very different strategy.
We've touched on this a bit already, but I just want to ask, why might oral CBD specifically be beneficial for hospitalized patients with COVID-19? I know you've touched on the cardiovascular aspects.
Sure. We have been working on trying to understand how acute inflammation injures the heart. And there are many pathways by which inflammatory reactions injure the heart. So then we went to the laboratory and we tested the effect of CBD in many of these pathways. And we were able to demonstrate that CBD in the lab, in injury that's produced by viral agents or by inflammation induced by chemical reactions or by inflammation induced by hypertension, regardless of the different modes of inflammation, CBD can block multiple pathways that in totality contribute to heal the heart faster. One of those that's very important is the development of fibrosis as it induced by the inflammatory pathways. Another one is that inflammation and at a cellular level can alter mitochondrial function, and it produces a sort of toxic molecule which is produced by oxidative stress. And CBD prevents oxidative injury, prevents fibrosis, and it creates in this context a more beneficial environment for the heart. All of these events occur in COVID. And if you can decrease the inflammatory response, you decrease all these elements that directly activate these pathways of injury in the heart.
So how does oral CBD potentially treat cardiovascular disease? Is it a treatment that would be supporting symptom management, or does it potentially span beyond that?
No, we are trying to demonstrate that in a certain group of patients, primarily those that have inflammation due to a viral insult, lowering the inflammatory response that occurs following viral injury prevents cardiac disease. So we want to demonstrate that there is less evidence of injury as demonstrated by biomarkers, that there is preservation of heart function as demonstrated by preserved cardiac contractility, which would translate at the clinical level of less hospitalization and less clinical heart failure. So the totality of it will be preserving cardiac function as it is affected by the inflammatory response that occurs following viral injury.
What else is in the pipeline for anti-inflammatory therapies?
So from within Cardiol, we're trying to study better forms of delivering CBD, forms that will be more effective, the strategies that will make it more accessible for a large number of patients, and also perhaps forms of delivery that will increase the therapeutic efficacy. So more potency with fewer side effects. So we're investigating many of those aspects, trying to increase availability, decrease potential side effects. So that's a very important big strategy. And we're also investigating other molecules that will have a specific interaction with unique cytokines, things that are in the pipeline at the basic level, maybe factors that prevent inflammation and oxidative injury. We potentially are interested in other forms of injury that also lead to inflammation. But at this moment, we're focused on viral injury, as it is in the case of COVID, or other forms of viral injury, in general myocarditis.
So what is the value of the pharmacist in the treatment of patients with cardiovascular disease and specifically having to do with viral injury?
You know, I think over the last decade or even a little more, it has become very clear that when you take care of a patient, teams of healthcare workers are more effective than just one person pretending to understand and know everything. Now, when you talk about the care of an individual, in this case, a patient that suffers cardiovascular disease or myocarditis, there are a number of drugs that are utilized. Let's take, for example, someone who suffers from heart failure, may take an ACE inhibitor, a beta blocker, may take an aldosterone inhibitor. It also probably will have diabetes, which will take insulin, or SGLT2 inhibitors, which are today mainstream therapy for heart failure. And many of those individuals also suffer depression, so may have an antidepressive agent. So there is not a single doctor that can integrate the totality of all these drugs, side effects, potential balance of therapeutic efficacy with side effects. So I think to have a team of healthcare workers that understand different aspects of it will provide great value to one particular patient. Setting protocols in large hospitals or healthcare settings would require, in a categorical way, the team of nurses, practitioners, pharmacists, because at the end of the day, therapeutic intervention requires the expertise of all of those. So I think that it's become invaluable in complex medical settings, the role of a pharmacist, to provide expertise that is not necessarily the expertise of the practitioner.
Do you have any closing thoughts?
Well, I think that in general, what Cardiol is putting in the table, it's for the community of researching the cardiovascular field, is to introduce or develop the necessary steps to understand ultimately if a molecule like CBD has a direct and a specific role in cardiovascular disease. We have strong evidence from a basic laboratory. We're initiating we completed phase 1. We're doing phase 2, 3 trials in 2 conditions that are of great importance at the moment, COVID myocarditis and myocarditis in general. But if we show positive findings, I think this will open an opportunity to understand and to pursue other indications where inflammation plays a key role in cardiovascular disease with a molecule that's very exciting, that provides a fantastic therapeutic potential. So I think that the opportunities are great, and we're very excited of contributing to the scientific field of and trying to eventually conquer heart failure, which is one of our objectives.
Thank you so much for taking the time to speak with me today, Guillermo.
You're very welcome. It's a pleasure.